In this presentation, we will aim to highlight the differences between the R number and the K measure of dispersion in understanding how best to treat a virus. This will be as a basis for our policy proposal, which will be to prioritise the implementation of backward contact tracing as a means to both combat the virus through identifying potential superspreaders, whilst also aiming to minimise the external costs of self-isolation while it can be avoided. The R number is a measure of a virus's reproduction that has been frequently quoted over the past 2 years when discussing the spread of COVID-19. It has gone from the topic of discussion largely among epidemiologists to being the topic of dinner-time conversation due to the scale and impact of COVID-19. In this presentation, we will aim to explain why, although a useful statistic in understanding the average infectiousness of viruses, there is another variable, the K measure of dispersion, which might be more useful for policymakers to make measured decisions for a virus such as COVID-19, where scientists have found the main cause of infection to be from so-called superspreaders. Before introducing the K variable, however, it is important to understand how the R number is calculated, and why this can be misleading in understanding the spread of the virus. R0 is the starting value of R and represents the basic reproduction number. This is the number of secondary infections generated from an initial case at the beginning of an epidemic in a completely susceptible population. The R number is the reproduction number at any time during an epidemic, which changes over time. This number is an average calculation of how many people would be infected by any individual who has the virus. For example, an R number of 3 would mean that, on average, one person will spread the virus to 3 more people. The main thing to mention here is that this is an average number. This means that out of 100 people, it could either be 10 infected people give it to 3 people each, or 1 infected person gives it to 30 people and the other 9 do not infect anyone. But the result is the same, that out of the 100 people, 30 are infected and an R number of 3. This is a huge downside to the measure, especially in the case of COVID-19, as the policy treatment for 1 person infecting 30 people is very different for 10 people infecting 3 each. This leads us on to the K measure of dispersion. Early research into the virus showed that as much as 80% of transmission events come from just 10% of all infected individuals. There have been many examples found over the duration of the virus of these super-spreading events, and they are a much more difficult thing to tackle. The K number is a measure of dispersion of the virus. The larger the number, the more consistency there is in the way the disease spreads, and the lower the number, the more transmission is from a few individuals. For reference, a study in July 2020 estimating over-dispersion in COVID-19 transmission found the K number for the COVID-19 virus to be around 0.1, whereas a study in Switzerland looking at seasonal influenza found a wide range of K values from 2.36 to 53.18. This provided us with a different way of thinking about the spread of the COVID-19 virus and for potential future viruses which spread in a similar manner, and will be the basis for our argument to support the use of backward contact tracing to help identify and isolate superspreaders early on.
Before we talk about backwards contact tracing, it's important to understand how forward contact tracing works and why it can be problematic. This form of tracing has formed the backbone of non-pharmaceutical public interventions against modern-day pandemics, especially COVID-19. The key aim of forward contact tracing is to find out details of individuals who have been in close contact with an infected individual in order to try and stop the chain of transmissions and avoid a surge of cases. As can be seen from the diagram, a contact tracer talks to an infected individual to find out everyone that they've been in close contact with from a certain amount of days. These individuals are then warned to test and self-isolate. This process is then repeated if these contacts then test positive. There is evidence from the COVID-19 pandemic response that effective forward contact tracing has helped reduce the time between the onset of symptoms and when a person begins to self-isolate, meaning the number of people exposed to COVID-19 was reduced. However, the process of forward contact tracing is not without its inefficiencies. As we can see from the graph, as the ratio of contacts needing tracing to tracing capacity increases, so does the R number. Furthermore, the greater the delay between symptoms starting and the start of tracing, the greater the R number. Forward contact tracing's efficacy therefore depends on participation in seeking testing immediately following symptom onset, quick return of test results, and sufficient contact tracing capacity if case numbers surge. In the UK, where there was significant investment in contact tracing, it has been determined that in 2020, tracers reached less than half of the close contacts of people who tested positive for COVID. This is because the process of forward contact tracing is a massive logistical process that needs all parties involved to play their part efficiently. And in reality, there are always delays, errors, and a lack of participation that massively affects efficacy. Finally, when forward contact tracing is working efficiently, it also results in many individuals isolating who may not even be infected with the disease. This results in a significant opportunity cost to the economy as individuals are unable to work.
The first and arguably most notable change occurred to the economy, which was hit very hard during the pandemic as a result of forward contact tracing measures, and affected most, if not all, private sectors, from finance all the way to hospitality. GDP declined by 9.7% in 2020, the steepest drop since consistent records began in 1948, and equal to the decline in 1921 on unofficial estimates. However, a recent survey from the end of 2021 suggests that 57% of respondents expect both the global economy and their country's economies to improve in the next summer. But unfortunately, this number fell from around 80% when the survey was last done in the summer of 2021, suggesting an increase in pessimism surrounding the UK economy. August was the first full month where there was no coronavirus restrictions in England, which contributed to monthly gross domestic product growing by 0.4% between July 2021 and August 2021. However, GDP remained 0.8% below its level in February 2020, which was the most recent month not significantly affected by the coronavirus pandemic. Furthermore, 724,422 people lost their jobs in Q2 of 2020, according to the Bank of England. Productivity also fell by a drop in output per hour of almost 2% in the initial stages of lockdown. Other implications of people self-isolating as a result of forward contact tracing measures during the pandemic include a vast array of social issues. Firstly, mental health was a particular issue, with bereavement, isolation, loss of income, and fear triggering mental health conditions or exacerbating existing ones. Many people were unable to see loved ones in hospital or attend their funerals. Having said all of this, very little data supports the hypothesis that this increase in the rates of depression actually led to an increase in the rates of suicide in the UK. However, this may in part be caused by a lack of data that we have on the subject. On the other hand, there is evidence to suggest that the self-isolation policies implemented did have negative repercussions for the elderly in society. A lack of mental stimulation saw those aged 50 and above in self-isolation suffer from a 50% increased risk of dementia. Another huge issue caused by self-isolation is domestic abuse, and our forced coexistence for many self-isolating in their homes with partners, coupled with economic stress and fear surrounding the virus, were to blame for an increase in calls and online requests for help from hotlines by 60% since the first lockdown began in March 2020, according to Refuge. According to London's Metropolitan Police Service, most calls came from third parties concerned with the living conditions of those, largely female, being forced to self-isolate with an aggressive partner, which led to abhorrent abuse. Specifically looking at the numbers directly affected by coronavirus, police in the UK recorded 259,324 domestic abuse-related offences in the period of March to June 2020 alone. This figure represents a 7% increase from 242,413 cases in the same period in 2019, and an 18% increase from 218,968 in 2018. Finally, as for health in general, those aged 50 and above particularly suffered as a direct consequence of forward contact tracing measures implemented. Scientists saw a 29% increased risk of heart disease and a 32% increased risk of stroke for those patients who were self-isolating or lonely.
Backwards contact tracing has been used in multiple countries throughout the COVID-19 pandemic, namely Japan and South Korea, but has not been implemented as widely as forward contact tracing. Instead of identifying individuals who the infected person, referred to as the index case, has been in contact with, it looks backwards to who infected the index case. This individual is commonly referred to as the primary case, and their contacts are then traced from there using forward contact tracing. Throughout the pandemic, it has been found that the majority of infections have been caused by a relatively small number of original cases and occur in clusters from specific superspreading events. One extreme example of a superspreading event that occurred over the COVID-19 pandemic happened during a church service in South Korea. From this service, one case eventually led to over 5,000 cases of coronavirus, in South Korea, which at the time accounted for over half of the total number of national cases. Superspreading events usually occur in locations which have poor ventilation and where individuals are close together for extended periods of time, which makes them easier to identify for contact tracers. The key concepts for why backwards contact tracing is more effective at identifying superspreaders is the friendship paradox, which assumes that your friends will on average have more friends than you do, meaning they will interact with more friendship circles and thus come into contact with more individuals with regards to disease transmission. As viruses are transferred through contact between individuals, it is far more likely that the virus will infect those with many contacts, and they will in turn pass it on to a greater number of people, resulting in these super-spreading events and clusters that have been observed over the COVID-19 pandemic. One study was conducted in the UK where music and business events took place with individuals who had tested negative for coronavirus on the day of the event. Despite these events being seen as being at a high risk of transmission of the virus, only a limited number of people reported becoming infected with COVID-19 afterwards, and of those that did, mostly were known to each other. This study demonstrates the effectiveness of combining both forwards and backwards contact tracing in order for events to still be able to take place during future pandemics and quarantine rules to be used effectively in reducing transmission. There have been numerous studies into whether backwards contact tracing is more effective than the more widely used forward contact tracing. The majority of these studies have come to the conclusion that backwards contact tracing is in fact more effective and is likely required if a country wants to reduce their cases to a low level, which is why we believe that during future pandemics a greater proportion of resources should be put into this policy. One study, which was conducted by the London School of Hygiene and Tropical Medicine, estimated that the addition of backwards contact tracing to the already implemented forward contact tracing system could make it between 2 and 3 times more effective, and another stating that backwards contact tracing typically results in a multiple-fold increase in the overall effectiveness of contact tracing. Another study looked at the probability of randomly identified cases leading to 5 or more further infections compared to a primary case identified through backwards contact tracing. It was found that for a randomly identified case, only 6% led to a further 5 or more cases, whereas a primary case had a 53% chance. With such a disparity in identified future transmissions, it is clear that backwards contact tracing is far more effective at reducing overall cases compared to forward contact tracing, which is only useful for mass testing only.
This presentation has shed light on an alternative key policy for non-pharmaceutical responses to pandemics. As such, we finally wanted to outline our policy recommendations for governments hoping to mitigate against the spread of future pandemics. Firstly, the main basis of a policy response to a pandemic should be established with more focus on the aforementioned K number rather than the R number alone. By studying the K number of a future virus, governments can understand the level of dispersion of a virus. A virus with a low K number has less consistent transmission, and more transmission is from a few individuals, as we mentioned earlier. In this case, we can see from the diagram backwards contact tracing that aims to find the primary case should be used in a combination with forward contact tracing to allow public health officials to more efficiently target isolation measures to those who are infected with the disease. This means isolation is more focused and there are less people isolating who aren't infected. Through enacting this policy, one is likely to see reductions in the R number, but also less economic damage from unnecessary isolation. Although we have highlighted the issues regarding the widely used forward contact tracing, it is important to remember that our policy proposal does not involve scrapping this technique, rather it favours a hybrid approach. Finally, what is vital to note is that every virus is different. However, in following our policy proposal, governments can tailor their hybrid tracing policies based on the size of the K number to enact the most effective and least economically damaging isolation response. Thank you.
In this presentation, we